$4 billion.
Leavers sought to table that document. Is there any objection? There is no objection. Maggie Barry.
Speaker, thank you. My question
number 6, I beg your pardon, Maggie Barry.
Thank you. My question is to the Minister of Health. What announcements has the government made recently on new facilities in the Public Health Service?
The Honourable Tony Ryle.
Mr Speaker, this week the government announced that the New Zealand Blood Service, in partnership with Ngāi Tahu Properties, is building a new blood donor and laboratory centre in Christchurch. The new centre is planned to open its doors in just over 2 years' time and will be a purpose-designed building that will house a donor centre, manufacturing and testing laboratories, specialised warehousing and support offices. In 2011-12, the New Zealand Blood Service collected 181,000 blood donations from 126,000 volunteer blood donors, just over 3% of the population. The new centre is important for the long-term future of the New Zealand Blood Service to ensure the ongoing blood supply to New Zealand public health services.
Maggie Barry.
What can the Minister tell us about a new multi-million-dollar mental health unit at North Shore Hospital?
The Honourable Tony Ryle.
Well, the government has approved a new $25 million inpatient mental health unit, $25 million inpatient mental health unit at the North Shore Hospital that will replace the current Taharoto unit, which is an old maternity hospital and is no longer fit for purpose. The new unit will not only be larger with 7 extra beds, the doctors and nurses working in the unit will be involved in the design to ensure it is more user-friendly for patients and in particular families. I'd like to thank the member for her representation on behalf of a number of families who've been concerned about the standard of the facilities. The building is expected to begin by the middle of next year and take around 18 months to complete.
The Honourable Marion Street.
Supplementary to the Minister, Mr Speaker. Does the Minister approve of the suggested model for the new elective surgical centre at North Shore Hospital, which includes financial incentives for surgeons of payments of up to $10,000 per day and excludes training options for younger doctors in training?
The Honourable Tony Ryle.
Well, Mr Speaker, I certainly support the elective surgery centre that is being built at North Shore at some tens of millions of cost. I'm not sure the member correctly characterises the features of that unit. Certainly those are the features that have been described by the Senior Doctors Union. I'm right behind the elective surgery centre because it will contribute to the more elective operations that New Zealanders want, where we are now delivering 30% more elective surgery than when we came to office.
The Honourable Marion Street.
Further supplementary, Mr Speaker. Does he see it as the way of new facilities in the Public Health Service that public facilities should be set up to funnel post-operative care to the private clinics of surgeons who work in the public facilities, as appears to be the intention of the new North Shore elective surgical centre?
The Honourable Tony Ryle.
Mr Speaker, look, I'm absolutely certain that the elective surgery centre is going to be a stunning example of innovation and new ideas in health. Quite clearly, we do need to look at more productive ways of getting services for patients using our dollars, and I welcome Dr Lester Levy and the clinicians at North Shore Hospital who have developed this elective surgery centre and the effort that they are making to get best value for our taxpayers' dollars. I want more hips, knees, cataracts done for the people of Auckland, and this is part of that.
Question number 7, Darian Fenton.
Thank you, Mr Speaker. Question to the Minister of Labour.